Good morning, everyone. It's November 17th, and it's starting to feel like winter if you are here in the Salt Lake City area. I think it was a hard freeze last night, and I just watched my daughter going to school in shorts, so that's great. All right, so we're really pleased that you're all with us today, and we'll go ahead and let's see if I can advance my slides. There we go, show you our agenda for today. So as we always do, we try and take a few minutes at the top to introduce ourselves. Big part of the Utah Children's Care Coordination Network is the networking part of things, and it's harder in a virtual environment, but I think it's important that we get to know who you are and a little bit about, your role and where you work, if at all possible. So fortunately, Zoom does have the chat feature, and you're very welcome to use that if you're more comfortable or if that's better for you, to let us know who you are. And we'll just try and do our best to go through both the folks who are on the side, and you're welcome to unmute when we call your name if that works, or we'll watch for your response in the chat. So that's what we're going to do next. And then we have some announcements that we usually talk about briefly. And if there's been any updates to the medical home portal, we like to make you aware of those. And then we always have a section that's really for you, and it's about whatever's going on in your world that you might want to share. So it can be some issues that you're trying to work through with cases and would like some help and some input from this group. It might be an update on a case that you brought to us earlier, and we love to hear about those. If you found a new resource or service provider, we love to know about that so we can share that with this group and also get it in the medical home portal. If there are any motivational interviewing stories you want to tell us about, any quality improvement efforts that you're doing, we love to hear about all of these. So know that that is your time, and we encourage you to take advantage of it, because this is a terrific group to get some help from and to share those things with. And then our main part of the meeting today is, interestingly enough, about care coordination. So we thought that we'd try and do a little deeper dive into it today, since that's really what we're all about. And we often, focus a little bit more on a condition or on a resource. And this time we're going to talk more specifically about care coordination. And while we've got this title, Tips, Tricks, and Tools of the Trade, meaning we're going to hopefully offer some of those to you, we also really want to hear yours. So please also know that that's, this is supposed to be an interactive meeting, and we hope you'll be thinking about what it is you do and be willing to share that. And we have some interactive features to try and make that go even better as well. And then we'll wrap up by 10. All right, so let's see, we'll do our welcome and introductions now. So I'm Mindy Tueller, and I manage the Utah Children's Care Coordination Network, and I am the Director of Operations for the Medical Home Portal, which is a big part of the resource part of this group, we hope. And I've been doing this for a long time, so hopefully most of you know me. All right, so I'm going to try and probably multitasking is not my best thing. So shall we start with what's in the chat, perhaps? I think I'll do a better job that way. All right, so we have Kylie Richardson, who is with us from Holiday Pediatrics. She's a nurse care manager. Welcome, Kylie. We have Alicia Mather, who is a nurse care manager for Memorial Pediatrics. Welcome, welcome. We have Steve Smith, who is part of the URLend group this year. Welcome, Steve. He is part of the Institute for Disability Research, Policy, and Practice at USU, formerly known as the Center for Persons with Disability. We're happy you're here. James Moore is the nurse care manager for Northern Utah Pediatrics in Layton. Welcome, James. Tinsley Douglas is a genetic counseling student, also part of the URLend trainee program this year. Tinsley, welcome. We really love getting the more diverse voices joining us. It makes for a much more robust meeting, so we're so pleased you're here. Alexa Black, social worker at Primary Children's. Hi, Alexa. So glad you're here. Laurel Bishop, URLand parent trainee. And, you know, the parent perspective, Laurel, is our ultimate perspective. So we're so pleased you're here, and yeah, please speak up. Lexi Stanley, transition specialist with the Integrated Services Program. Lexi's still relatively new, and we're so pleased to have you join us, Lexi, and particularly with your focus on transition. Carly Allen, oops, that just jumped up, patient navigator at Huntsman Cancer Institute for adolescents and young adults. We're so pleased you're here, Carly. Welcome. Erica Wall. Erica is an RN and care coordinator for the Integrated Services Program, and she covers Duchesne, Uintah, and Daggett counties. Oh, so important to have our, you know, slightly more far-flung areas of Utah represented. So thank you for being here, Erica. Dawn Galloway, a nurse care manager for Budge Pediatrics in Logan and also Northern Utah Peds in Ogden. Welcome, Dawn. All right, so I think I've covered what's been put in the chat so far, and you're certainly welcome to continue to do that. And then I'm just going to go down with who I'm seeing in the Zoom thumbnails. So I see Gabby next.
Good morning. So my name is Gabby Baragoshi. I'm a quality improvement coach with UPIC. And I just want to say that we just finished our in the final months of our mental health access integration project. And if I might have 5 minutes in the next meeting, I would like to share what we accomplished and what we found and what we improved on. So yeah.
Oh my gosh, yes. Okay, we'll plan on that.
I will definitely make a little 5-minute talk about that. Yes.
Okay, excellent. All right, and Michelle.
Yes, good morning. I'm Michelle Redfield. I'm the administrative assistant for the Medical Home Portal, UCCCN, and a few other groups at University of Utah, General Pediatrics.
Thanks, Michelle. All right, and Eric Christensen.
Good morning. My name is Eric Christensen. I am the program manager for the Integrated Services Program with the Utah Department of Health Bureau of Children with Special Healthcare Needs.
And Eric will be presenting to us for a few minutes and be a big part of our discussion this morning. And Tina.
Hi, I'm Tina Purcells. I'm a parent consultant with Utah Family Voices at the Utah Parent Center. I am also a family author for the Medical Home Portal, and I'm a parent of a spunky 21-year-old who lives with multiple disabilities and is super awesome.
We appreciate Tina for all those hats she wears so much. Glad you're with us, Tina. All right, let's see who I see next. How about Athena?
Hi, I'm Athena Parker. I'm also with the Medical Home Portal and help keep the Utah Services Directory updated and work with our other state partners.
Yeah, glad you're here with us, Athena. All right, so this is where it gets a little trickier for me. So I'm going to try and make sure that I'm not asking somebody to speak twice or overlooking anybody. So Amalia.
Hi, my name is Amalia Kamano. I work with Gabby and Heidi with the UPIC and UDAC Clinic at the University of Utah. I'm a project coordinator.
Glad you're here. And Brooke Christensen.
Hi, I am Brooke Christensen. I'm a care coordinator with Utah Valley Pediatrics in Saratoga Springs.
Wonderful. Glad you're here. Okay, and Heidi Bates.
Hey, I am, let me see if I can get my camera to work. It's kind of weird, funky. I don't even know. Oh, there, kind of I am. I'm Heidi Bates. I am also with UPIC. I work with Gabby and Amalia. And just so you know, we are starting our asthma collaborative in January. We do have room for a couple more clinics. So just keep that in mind. If any of your providers need MOC Part 4, we do offer that. If you're interested, just shoot me a text or email, chat, and we can get you signed up. Thanks.
Terrific. Thanks, Heidi. All right. How about Janet with Southwest Children's Clinic? If you're able to unmute, Janet. and that's okay. We're always happy that when the Southwest Clinic folks are part of our group. And Jill with Shriners.
Good morning. I'm Jill Connor, Director of Business Development at Shriners Hospitals for Children in Salt Lake City. And I'll have to take that back. We've changed our name. We're still getting used to it, but it's Shriners Children's Salt Lake City is our new name.
Okay, just keep reminding us of that.
Yeah,
okay.
I need to remind myself.
Great. It'll work for all of us.
Thanks.
Glad you're here, Jill.
Thank you.
All right. And Kelsey Hamadou.
Hi guys, I'm Kelsey. I am a school nurse with San Juan School District. I cover 2 schools in the Blanding area. It's good to be here.
Well, you're doing a really important thing and we appreciate it, Kelsey. We're so glad that you're with us. That's great. All right. Let's see, Natalie Carter. I'm not sure that we read anything from you in the chat. So Natalie.
Hi, I'm Natalie Carter. I am a registered nurse and a care coordinator here at Central Utah Public Health Department.
Oh, wow. Wonderful. Thank you for joining us. All right. And I see Rebecca. Rebecca, are you able to introduce yourself?
Yes, I am a care manager at the University of Utah Farmington Clinic.
Excellent. That's right. Glad you're here.
Thank you.
Okay. How about Tony?
Hi, I'm Tony Estrada with the Integrated Services Program, ERIC's group. I'm a care coordinator mainly in the Ogden area.
Welcome, Tony. And how about Walt?
Yes, good morning. This is Walt, Integrated Services Program, also with Tony and Eric, and I'm in the Salt Lake office.
Great. Welcome, Walt. Yvette.
Hi, my name is Yvette. I am a patient care coordinator at the General Pediatrics Clinic here at the main hospital.
Glad you're with us this morning. And then I see that Sherilyn Hess has put in the chat. She's with Intermountain Pediatrics in American Fork. Welcome, Sherilyn. And also Angie Richens has joined us. Angie is the Director of Behavioral Health and Case Management for Alpine Pediatrics in Utah County. And we're so happy you're with us, Angie. All right, I hope I covered everybody. Oh, Natalie Allen. Hi, Natalie.
Hello, thanks. I'm a few minutes late to the meeting, but I'm Natalie Allen. I'm the nurse practitioner with Integrated Services Program, and I cover all of Eric's clinics.
Excellent. And I also see Cynthia. Cynthia,
good morning. I'm Cynthia Palacios Gutierrez, and I'm the clinical psychologist for the Integrated Services Program with Eric Christensen's team.
Yay, we got most of Eric's team, if not all. That's terrific. We love it. And I just see someone on the phone, and I'm not sure if they may also be on camera. So 768 number. Probably. Well, we'll call it good. We did pretty well, I'd say. Excellent. Well, welcome everyone. And let's go ahead and jump into some announcements. Housekeeping. So as we have moved fully to Zoom, we feel like if you're able to join on a laptop or a desktop, that really is the best experience. So you can fully take advantage of many of the Zoom features that are interactive and really let us have the best robust meeting. And we will end promptly at 10 o'clock. So we want to let you know that in January, we're going to change things just a little bit. And we're actually going to, again, try and take full advantage of the fact that we're now a Zoom group. And we're going to do Zoom registration so that in order to get the actual link for the meeting, you'll need to do one step first. And it can be done kind of just once, and then you should be able to go ahead and get the information for all of the meetings and just have those on your calendar, just the same as we had done before. But hopefully this will remove a few of the issues that we've seen in the past. mostly user error, me. And also it'll help us to understand a little bit better who is joining us. And because, reporting on what we do here is part of, us being able to do it, that will help everything. And so what we'll need to do is delete and stop the old meeting invite with the old Zoom information, and then there'll be a new invitation for you to do that. So we'll let you know. This meeting will remind you again next meeting, and then after the next meeting, we'll take action and you'll see some things coming into your inbox. I don't think it'll be any harder. In fact, it might be a little easier. So thank you for helping us with that. And then we wanted to remind you about the fact that my group is now taking over the Pediatric Project ECHO for the University of Utah. And we were able to collaborate with USU this fall on 10 sessions having to do with opioid exposure in infants. And there's still a few of those sessions left before the fall period is over, and they've been great. And so they happen to be on Wednesdays at 12, which we know can be hard, particularly if they're also on a UCCCN day, as the meeting is today. But they're also recorded, and we will make sure to send that link out to you in our meeting summary. And really, these have been excellent. So we would just encourage you, if you're not able to actually join and attend those in person, to go ahead and check out the meetings after the fact and watch the recording. We will be continuing to do some really exciting things moving forward in our spring session, which begins in January. And we have some great topics coming up, including palliative pain management, information on foster care, medical neglect, mental health of parents of children with special health care needs, a lot of really great stuff coming up. And so as we get closer to that, we'll make sure you're aware of what those dates are and how to participate or watch after the fact if you're interested. All right. And we just want to remind you about the Spark Autism Study. It's such a great opportunity for families who you may be working with who have a diagnosis of autism. I don't know if Amalia, you want to take a moment and say anything about this. I don't want to put you on the spot.
Oh, no, you're completely fine. I think we've mentioned it in the past for people that are familiar with it. It's a genetic study for Spark. And I'll drop some information in the comments with my email and the website, so you can reach out to our team if you have any questions. But it's very quick. They don't have to participate in the genetic portion of the study if they don't choose to. So they can definitely just go to the website and answer some questions, but they are eligible for reimbursement, a $25 gift card. So I'll go ahead and drop that information in the comments. Thank you.
Great. Yes. And it's free and really easy. So yeah. And hugely helpful. All right, some updates to let you know about. So on the medical home portal, we've had some content updates. We have improved the diagnosis module on maple syrup urine disease. And just to remind those of you who might be new, our diagnoses modules are written for primary care providers, and they are quite comprehensive. So they go into depth about these chronic conditions in children. And then we have a page that we recently renamed, and it's called Affording Formula, and it's just been updated as well, which I think could be very helpful for some of the families that you work with. And then some content that really is focused on families specifically is our apps to help kids and teens with anxiety page. And it may not be surprising to know that that is our most visited page right now. So we have just done a nice update there. And again, these links will go out in our meeting summary. All right, so this is a teaser. Athena, do you want to take over for a second?
Sure. So today, instead of highlighting anything on the portal, I actually want you guys to think about one thing on the portal that maybe you go to frequently or that you find is a really valuable resource or feature that you really like. And just start thinking about that now, because we're going to circle back to that in our discussion area at the end. So start thinking about what it is that you really like or use most on the medical home portal, and be ready to share in a little bit.
Awesome. Thank you, Athena. Okay, so as I mentioned, this brainstorming time is really your time. And so I'm gonna step back and be quiet. And if there's anything kind of along these topics, these ideas here, or wins. So we've kind of got these two slides that show you the stuff that might be a little harder that you're dealing with, and a little more I don't know, positive. So, but we want to hear all of it. So please let us know if there's anything that you'd like to share.
Mindy, this is Dawn. I have a question. I've had a couple families that are looking for help getting like a lift to transfer their child from their wheelchair into their vehicle, or like a lift that will hook into the hitch of the back of their vehicle that's motorized for their wheelchair. What resources do you guys know of to help with that type of equipment?
That is a great question. And I will be looking on the medical home portal, but does anyone else have any information for Dawn on a wheelchair lift?
Hi, Dawn. This is Jill from Shriners. I could forward that question request to our wheelchair and seating department. And I'm assuming that they would have some contacts for you to make a connection with. So if you want to, I'll put my email address in the chat. And if you want to forward me an email with that question, I'll pass that along.
Thank you.
Hi, this is Eric Christensen. We used to work with a physical therapist, Terry Holden, who has retired, but Terry Holden knew all things assistive technology, modification, and had a lot of different connections. I'll put word out to her and see if I can't get some information back. So I'll put my contact information in the chat, my email address, and kick me off an email, and I will see if I can get some info back from Terry to share with you.
Hi guys, it's Tina. I wanted to apologize. I had to walk away for 1 second, but I did hear wheelchair lift for a van or a house.
Yes, van.
Okay, so has anybody contacted the Independent Living Center?
I'm new to care management, so I have not, but I will try
Okay. So Utah Independent Living Center is one, and they do funding. So years ago, we got a van. Actually, Carl Malone gave us a van, which was interesting. But it didn't have a lift in it. So we used Utah Independent Living Services, and they have funding that comes to them yearly. Sometimes it has run out, so you got to kind of look at their timeline of how their funding runs yearly. But I bet you they probably also have some extra funding from some of the COVID. I mean, I'm imagining they might. And then Utah Center for Assistive Technology is the other one I would suggest. Where does the family live?
No, actually, they both live in Ogden.
Ogden. Okay, then we want to go to Roads to Independence instead of the Independent Living Center, which they'll all connect you. And then if you want to email me, my email is tinap@utahparentcenter.org, and I can try to pull anything else.
Thank you, guys.
You bet. That's what we're here for. So we will also put some of these things that we're gathering, all of these things that we're gathering in the summary of the meeting that gets sent out. So great. Thank you, everyone. Sorry. Okay, anybody else?
I have a family who is needing access to an iPad or a computer for physical therapy. I know that this isn't something that maybe insurance will cover, so I wanted to know if anybody knew of any resources.
Beth, this is Eric Christensen again, not trying to monopolize a conversation, but we do have Chromebooks available for loan to families who could, we're trying to do like telehealth and that sort of a thing. Is that what we're looking at? Is this family trying to doing some kind of like remote telehealth? Where does your family live?
I believe they are in Salt Lake.
Perfect. We have placed Chromebooks and hotspots if they don't have terrific internet access. We have those placed at the Utah Parent Center for folks in Salt Lake.
Perfect.
And I would say contact Utah Parent Center and say Eric Christensen sent you, and that you would like to see if you couldn't get, connect the family with a Chromebook and a hotspot if they need both. We're happy to do both or either. So
Perfect. Yvette, you can just contact me, Tina P at utahparentcenter.org, because I'm kind of I can go in and make the request for you and all that.
Perfect. And is there a certain time that the parents are allotted this equipment?
People have not made a run on the equipment. We thought initially that people would be beating down the door. So right now is a good time to get a hold of the equipment because they can use it as long as they need to right now. They do sign an agreement that basically says they'll take care of it. They won't use it for nefarious purposes, anything illegal, but we would certainly be happy to lend it to them as long as they needed it. And if we found that we were getting, really tight down the road and needed to get it back, we can certainly reach out to the family. And
perfect. Thank you so much.
Absolutely.
I love it. I love it. This is what it's all about. Anyone else?
This is Brooke Christensen. I just have a question about information on the care coordinator or care management with the comprehensive care clinic. I don't know if someone who works with the comprehensive care clinic is part of this group, or if anyone knows like the care manager that works for like Dr. Dangerfield's office or the comprehensive care clinic.
Are you talking about primary children's comprehensive?
Yes.
Okay. So I just had a baby that I had to send there. So I talked, so what kind of doctor is he?
So I don't know specifically what his title would be, but just with the comprehensive care clinic, they coordinate with multiple providers at once. So when they're going for their appointments, they're able to see multiple specialties instead of having to go up for multiple appointments. And
yeah, so the way I did it is I reached out. So we had to have them set up with pulmonology and they couldn't get in for a long time. So I called the actual pulmonology office and they are the ones that got me connected to the comprehensive care clinic. I just asked for that, but they do have to meet certain requirements. I think they have to have 3 conditions or something. So
okay. Yeah, I have a patient that's
I just reached out through them and
right
then
now.
Oh, sorry,
I have a
go
patient
ahead.
that's working with him right now, and my provider has just been back and forth with Dr. Dangerfield, and he had mentioned reaching out to his care coordinator, and so I just wasn't sure if they were part of this group or if anyone had their information, but I'll just reach out to their office and
yeah,
that's what I did. Is I
is
reached out
Heidi
to like
with-
that office and then got the contact through that office. It was kind of a pain, but that's
Yeah.
all.
Okay.
Yeah,
Okay.
this is Heidi. I was a care manager for a while. I've worked for Primary Children's for years. I know who the care managers are. They don't like to give out their like information because they get inundated, as you can imagine, because I think there's only 2 of them. So if you call the main number, what is it, 213-3599, I believe, call them and just ask, like, Dr. Dangerfield, Dr. Dangerfield has asked us to get in touch with the care manager in order to do this. And they'll call you back. It might take a day or 2, but they will call you back.
Okay, perfect. Thank you.
Yep.
Thank you, everyone. All right. Anybody else?
Hey, this is Alexa Black from Primary Children's. I have been wondering about some additional training on refugees and undocumented individuals and resources for for those populations. Does anybody have any ideas for who I could reach out to for just like extra training? We do for our team some presentations, and I would love to reach out to somebody who could come and maybe speak to.
Hey, Alexa, this is Heidi Bates again. I used to work for the Redwood Clinic.
Oh, awesome.
And that is the majority of their population is refugees.
Mhm.
Her name, what is there one like population inside the refugees? Like, is it Somalia or is it just refugees in general?
Just refugees and undocumented people in general.
Okay. She is the refugee coordinator at the Redwood Health Center, and her name is Anna.
Okay.
And let me find her information for you. I'll send it in the chat, but they actually made that position at the Redwood Health Center because they needed that position. They needed someone that's just dedicated to that. So I'll put her email in the chat, and she'll get back to you. They do a lot of like at the Redwood Health Center, they do a lot of like Wagma Momond. She is one of the PAs, and she does like teaching on I can't think, Ramadan, like what to eat, why it's healthy, what to eat that's healthy. I mean, they do a lot at that clinic. So I'll find her information and put it in the chat for you.
Okay, thank you.
Yeah.
And Alexa, honestly, this is a great topic for us to discuss here at UCCCN. So that is probably something we should address here for the wider audience, I'd say in the next few months. So
yeah, and Anna Gallegos is her name, and she's the refugee coordinator. She coordinates with like the Catholic Community Services, AAU, like she knows everybody in the refugee house, she just so let me put her, and that's maybe something that we can talk about, but she would be her and Wagma Moment. They're pretty passionate about this dynamic, and so yeah, something to think about, but I'll put her information in now.
Yeah, I am getting a lot of things popping up in the chat, including a couple of other recommendations that are the Asian Association of Utah. They are great. Yeah. And also International Rescue Committee. And then just in general, it sounds like this is something that we should try and make a meeting about. And so we'll see if we can find some folks who will come in and share. We did a learning session years ago and talked a little bit more about undocumented families and some of the resources available to them. This would be, I think, a slightly different focus, but this is great. So thank you very much for bringing that subject up, and we'll make sure that you have some information now, a lot in the chat, and we'll get that in the meeting summary as well. But we'll follow up on this again as a more specific focus topic.
Thank you.
Great. All right.
Mindy, I've got kind of a odd one.
Okay. Hi, Jennifer.
Hi, this is Jennifer Goldman with the. I actually got asked about whether there are any programs in Utah or Oregon that focus on reuniting a teen with significant mental health and trauma background with a family member that he's been detached with. So from his mom, who now has legal custody, but he's like been pitted against her for years by the dad. And so they're trying to find some kind of facility that might facilitate this. And they were told the only place that was good at this was in New York City. So I thought I'd see if anybody had heard of anything like this, either in Utah or Western states. It's kind of weird.
Hi, hey Jen, it's Heidi again. I'm working in a collaboration with behavioral health organizations. So just like LCSWs and psychiatrists across the state currently. We have a meeting coming up tomorrow. I can ask them if they know of anybody that could help facilitate that and get back to you on that.
That'd be great. I think they're looking at paying out of pocket for an intensive across the country program. So
wow.
Family.
Yeah. Let me see what I can figure out and I'll get back to you.
Thanks. That'd be great.
Yeah.
Thanks, Kylie.
Okay. Great. Oh yeah, we'd be really interested to know what you learn, Heidi. Thank you.
Yeah.
You say it's a little bit different, Jennifer, but I wonder if, that's something that happens maybe more frequently than we even know. That family reunion.
And for so the child, the youth isn't in state custody. It's a matter of living one parent and going to live with another. Because I was just thinking, I mean, there are reunification programs through Human Services here where they work to try to get kids back into a household. I don't know what types of, but if you're not a ward of the state or on Medicaid or something, I'm not sure if they qualify for that type of service.
And I also remember, so we had them on the medical home portal or the UCCCN meeting before the pandemic. And they work with JJS, and I can't remember what that organization was, but it was something they try and keep the kid, they work with the family to keep the child inside the home. And so I'm wondering, her name is Amanda. She's the director I'm working with. I'll reach out to her and see what they can do, but I can't remember that program that they came and talked to us about. It was in one of these meetings and it was like I said, before the pandemic.
Okay.
Before I started with UPIC too. So it's been
a little while.
It's been a couple of years. Yeah. But let me see what I can figure out with, I'll email Amanda right now and see what I can figure out.
Thank you. Wonderful. Okay. It looks like we need to get the Unified Family program in our database as well. Well, this has been great. Thank you, everyone. We really like it when there's cases and help requested and you can get all these voices piping in to help. So that's exactly what this group is for. And I will just take a moment at the very end of the meeting. I'll post the listserv email address, but I just want you to know that listserv that we have is exactly for this kind of thing in between meetings. So just know you don't have to wait until our meeting if you have a question or a concern or would like to ask for some crowdsourcing for help, and that you're welcome to just email me and then I send that out on your behalf, or you can email directly to that listserv and that's what it's for. And when we do put out requests for help and information on that, it's just wonderful to see how many responses come in. So I know that this is just a fantastic group who all want to help. So. All right, well, I think we better get going on the next part of our meeting. So care coordination, tips, tricks, and tools of the trade. I would say that certainly one of the tips would be come to UCCCN and ask for help from your peers. Wonderful. All right, so we're going to start with some questions for you. Thank you, Kylie. I see that you put Unified Family Therapy in the chat. Thank you. So we're going to start with a poll. So let's see, Michelle, you want to pop that up? All right, so we are hoping that you guys will take a couple of minutes and go ahead and answer these questions as best you can. If you have an answer of other, feel free to put that other in the chat if you're comfortable with that.
What's the EHR?
Electronic health record, EMR.
Okay.
I don't see anywhere I can select anything. It looks like the answers section.
Oh, Eric, I think it's because you're a co-host.
Gotcha. Okay, perfect.
Yeah, it's working for me.
Oh.
It's kind of fun to see the answers come in, isn't it?
And Natalie, you should be able to, like if there's
No,
any
it
others.
is, yes,
Oh.
it is working. Sorry, that's what I
Okay.
meant to say, yeah.
Perfect. Okay, thank you.
I'm answering as not really a care coordinator, but kind of, so I'm kind of other.
All right, it looks like we'll just give it another minute or two. Seems like we've got probably the majority of folks' answers in. Okay, it looks like things have slowed down. I think we're probably done there. That's very interesting. Okay, so we'll probably come on back to this in a minute, and we'll go ahead and have Eric talk a little bit about the Integrated Services Program and some of their tips, tricks, and tools. Let's see. I'm going to stop sharing now, Eric, and let you do that.
Well, and as I said earlier to Mindy, you would think this is my first Zoom experience ever. I'm going to hope this actually shares my screen. So let me share. What you should see is my entire slide deck, really small down the side, and then the main one. I am not going to be able to do an animated presentation. So tell me if you can see that. Mindy, I get a thumbs up. Is that correct? All right, folks. I hope the font is large enough. If not, I'll send it out later, and my apologies for that. As I stated earlier, my name is Eric Christensen, and I have the incredible fortune of being the program manager for the Integrated Services Program at the Utah Department of Health. We are part of the Bureau of Children with Special Health Care Needs. I have been in the Children with Special Health Care Needs arena for the past 22 years. And several of my staff have been doing this almost as long as I have, if not longer. So we're very fortunate to have an amazing team, and it's always fantastic to work with all of you as well. I'm going to talk a little bit today about care coordination and what we do in Utah Department of Health, and specifically the Integrated Services Program. And just because I'm presenting, in no way does this mean that we've cornered the market on all things care coordination, but we want to talk a little bit about how it works for us and what we do. We are fortunate in that all of the children who are referred to us are kids with special health care needs. So if we receive a referral and we're doing care coordination and helping with the family, more than likely that child has special health care needs or is presumed to have maybe a diagnosis that would qualify the child as having special health care needs. So all of the kids that we serve fall into that category. So we're not dealing with the general pediatric population per se, but usually kids who meet certain criteria. Our mission is to assist families of children and youth who have special health care needs by facilitating direct clinical services, care coordination, transition to adulthood, and advocating for primary care and comprehensive health care. I just want to show you quickly where we have staff as part of our program. So in Salt Lake City, I find myself here working out of my home most days. Our advanced practice registered nurse, Natalie Allen, our psychologist, Cynthia Palacios Gutierrez, and then we have two care coordinators, Walt Torres and Lexi Stanley. I speak Spanish. Cynthia and Walt also speak Spanish. Lexi is our transition specialist, so working with kids from 12 to about 21. And then our other care coordination staff in Ogden and part of the integrated services program is Tony Estrada, and she also is Spanish speaking. And then we contract with 4 local health departments and have had just amazing care coordinators on the local level in rural Utah. So in San Juan County, they have just hired somebody, and they're going to start on the 22nd of November. And we're delighted to have somebody back in that office. In Central, I need to update my slides. It says Linda Stevenson, but it is actually Natalie Carter. Natalie, my apologies to you. I will update my slide, duly noted. And Natalie has just started with us, and we're delighted to have her. In the Southeast Health Department, Gwen Anderson, she covers Moab and Price. And then in the Tri-County area, Erica Wall. And we are really delighted to have such astounding people on the ground, boots on the ground in all of those areas. The Integrated Services Program has 4 main components, or programmatic components, if you will. Number 1, bold, underlined, is care coordination. Everything we do in our program hinges on care coordination, follow-up, connecting with families, trying to ensure families get the services that they need. So we have care coordination, we support the medical home, we promote the transition to adult medicine, and then finally, we provide very limited, operative word here, limited direct clinical care services. Number 2 and 3, supporting the medical home and promoting the transition to adult medicine are actually goals within the Maternal Child Health Block Grant. We receive money in the state every year for maternal and child health issues. 30% of those funds must be used for children with special health care needs. And our 2 block grant goals, if you will, are working with the medical home. So that's one, and making sure families have the support they need. And the second one is promoting that transition to adult medicine. So first of all, for care coordination, we receive a referral. Families can be self-referred, referred by a provider, medical provider, a service provider, early intervention, the school district, whomever. We're glad to take any sorts of referrals. And initially, we will do an intake and an assessment. We want to get into the nitty-gritty and find out what's really going on with the family. Quite often, providers will send over a request for us to do an intake with a family, and they have certain concerns. But as we interview that family, we realize there may be a whole bunch of other things that we need to address as well. So for us, that intake and assessment is probably the most crucial piece, so we can find out exactly what families need and what their children with special health care needs need. We work with those families to create a care plan, and quite often, as most of you will be aware, our families have a lot of stuff going on. So we try not to inundate a family with too many things at once, but work on the most urgent, critical need at hand, get the family stabilized a little bit, and then try to work on maybe medical or social service goals or things like that. We work to connect families with Medicaid, CHIP, private insurance, help families understand their benefits. We try to connect families who may have children who might be considered disabled with the Social Security Administration to work on qualifying for Supplemental Security Income, or SSI. We also work with families to help organize their medical records, and we have a really great section on the medical home portal that's all about a care notebook. And if you are not aware of that, that is something you should look up and share with your families. It provides a nice I don't want to say concise because some of these people have volumes and volumes and volumes of records, but it kind of a nice organizational way to track all of those years of history information, and more importantly, the most current documents that you receive or your families receive from the specialists that are working with them. In integrated services, we've looked at housing, financial issues, food issues, concerns like that. It's very hard to be smug about working on medical compliance when families are facing homelessness, eviction, or lack food in their household. We also explore educational needs. So we're looking at individualized education plans, IEPs, 504 plans, medical accommodations at school, and work with the school and with the family. And certainly we pull in the Utah Parent Center and their IEP specialists over there to work with our families. We partner with a primary care physician, and where no primary care physician exists, we try to get families connected with primary care. We then make referrals to appropriate support organizations, including medical, social services, behavioral health. And then the biggest part here is that consistent, regular follow-up. We try to set alerts within our medical record system, our EMR, to follow up with families on an as-needed basis, but at a minimum every couple of months, just to ensure everything is going well and that families are able to work towards any sort of goals that we have set for those families or that we've mutually set to ensure that they are connecting with support services and specialists in the community. The next part is supporting the medical home, and this comes in under care coordination. We know that a lot of practices out there do not have the luxury of having someone on staff that can serve as a care coordinator. We work with a lot of small organizations, particularly rural areas where it might just be a couple of nurses and a provider in an office. And we can act as that care coordination piece through our integrated services program. So we really like to partner with those organizations around the state, and we want to let them know that there is backup and support. And I just want all of you to know that if you are a care coordinator in your office, you might be restricted on what you're able to help with. Just know that integrated services is here to help back you up as well if you need just a little more help connecting families and supporting the families that you serve. Again, another important thing is obviously this group. You heard the great sharing that goes on, the listserv that Mindy already mentioned. If you are stuck on what resources exist or if something even exists at all to help a family, please reach out. I'm amazed when the listserv goes out and people ask a question. We get anywhere from 5 to 25 responses from people who will say, oh, have you tried this, or this? So please reach out, know that you're not alone. We're willing to help in integrated services and definitely willing to help as a larger group at the Utah Care Coordination, Utah Children's Care Coordination Network. With supporting the medical home, we partner with the primary care physician to provide care coordination. We work with the family, provide feedback, provide reports and information back to the primary care physician. We really try hard to make a warm handoff and introduction to service providers in the community that will be partnering with that family. And then we try to facilitate specialty care and connecting with those community services. Our next piece is our transition to adult medicine. And we start working with kids as early as 12, 13, 14 to get the families to start thinking about stuff that's coming down the pike. We have a lot of kids who will probably not be able to live on their own and make all of their own decisions. And so we want families to be aware that once those kids turn 18, they become adults, we need to look at issues such as guardianship, supported decision-making, special, possibly able savings plans that help families prepare financially for their child growing into adulthood. And then working very closely with current providers to ensure that kids are ready to move into adult medicine. There are a whole bunch of parts and pieces there. And we just had an incredible transition summit sponsored by Intermountain Healthcare, where we talked about ways to connect families and prepare families for what's coming down the pike as their child gets older. I think a lot of times families aren't always sure their kid is going to make it to adulthood, but we want everyone to be prepared because technology is so good anymore that a lot of our kids who might not have made it into adulthood are definitely doing that anymore. And we want families to be prepared with that. And just so you know, this is the one area where we have a separate registry for all of our kids who are of transition age. We went into our electronic medical record a couple months ago. We pulled all of the kids from historical records. And let me just say here, we converted to electronic medical records in 2012. So we've pulled all of the kids that we have seen in the Utah Department of Health since 2012 up through present day. And we look for all kids who were 12 to 18. We had, I want to say, over 3,000 kids in that group. And so we said, that's a lot of kids. We parsed it down and we said, let's look now at 16 and 17-year-olds to try to work with them first because some of them may have the most acute need. And our transition specialist, Lexi, is calling those families, letting them know about transition services and planning that we offer, and trying to work with those families to create care plans. And just because we're working on transition, it doesn't mean that all of the other parts and pieces of care coordination go away. Our transition families also have concerns about housing, food insecurity, educational plans, things like that. So we're working on the full spectrum of care coordination, but also focusing on that additional piece of what happens when your child turns 18 and becomes an adult. The last part that we provide is very, very, very limited direct clinical evaluation and diagnosis. And the majority of that takes place via telehealth. Quite typically, our nurse practitioner, Natalie, and our psychologist, Cynthia, are working with our care coordinators to help families, particularly in rural Utah, with quite often behavioral health needs, medication support in conjunction with their primary care physician. But with a very limited clinical staff, we quite often work with families to try to refer them to other services in the community. We do a lot of autism evaluation and diagnosis, but that is very lengthy and time consuming. And so we cannot see a large number of children for that. So we try to refer families to other services where they can get that diagnostic evaluation. One other piece I wanted to mention within the clinical services, we have in several of the local health departments, early hearing detection and intervention has placed audiology equipment, and that allows our folks in Salt Lake, our audiologists in Salt Lake, to remotely connect with families and get audiology confirmation and hearing testing done remotely. So we're very proud of our partnership there. One last piece, we've already talked about it, but it's our integrated services program, Technology Lending Library. We want you to know that this is available to your families. So if, like our friend this morning, you had a family who needs technology, if you discover families who need to borrow something, please reach out to us. You're welcome to contact Integrated Services directly, my program, and we'll be happy to connect you with whichever local health department, Utah Parent Center, or even our own office in Ogden to ensure that we can get your family some equipment. And that is my last slide, just our contact information here. I'll make sure Mindy has these slides and she can send them out to everybody. But we just want you to know you are welcome to reach out to us at any time. We would love to help, and we'd love to partner with you with any families you might need help with. And I will stop there.
Thank you so much, Eric. Does anyone have any specific questions for Eric, or would you like to chime in after hearing anything that Eric mentioned? As Eric said, the Integrated Services Program has I'm not sure exactly the right word. I'll say luxury. It's not a luxury, but the opportunity to stay focused on children with special healthcare needs, so that they can sort of be in that mindset all the time. And I know that most of you don't have that as your, the group of families you're working with. You're working with families of with a lot of different kinds of needs. And so just know that it is pretty wonderful that the Integrated Services Program is set up to really be there as a resource for you. I'm going to go ahead and share my screen again. And I just want to mention that, we have other resources as well that you hear us talking about a lot. And we really want to make sure that you know that that's what they are there for. So the Utah Family Voices and Utah Parent Center organizations are also really amazing. And I don't think a meeting or discussion goes by where I don't bring them up. And so, of course, we have Tina here, and we're so grateful for her knowledge and experience and input. Tina, without asking you to, go into any great detail, I'm sure that you guys have a number of tools and processes that you use as well to help when you get a call from a family. If you don't mind just taking a moment or so and just explaining kind of a little bit about the access for getting help through you guys.
Yeah, so the Parent Center is a nonprofit, and Family Voices is a grant under the main umbrella of the Parent Center. The Parent Center itself holds many different contracts and funding streams, and they are getting to be more and more and more these days. So we have, specific grants that allow us to work on specific things. Like we have a piece for autism. We have Family Voices, which allows us to work directly, one-on-one with families to help them solve problems. One of the main things about us is that the Parent Center is we're a parent-to-parent model, and so or a family-to-family model, I would say. And so any consultant that you speak with or that a parent is connected with is going to be another parent of a child with a disability. So, sometimes that allows us to be able to give some of that personal experience. Like, for example, I might have a doctor who contacts me and says, I've got this child who will not keep their G-tube in their belly and they keep pulling it out. And I can call them as a parent and say, oh, we've had issues like that, or I know someone who's had issues like that, and let's see what we can do. Let's see what we can MacGyver, at home, because that's what a lot of us parents do with certain situations. And then also, excuse me, the Parent Center does work one-on-one with families on the IEP and education piece as well. A lot of my tips and tricks, tools of the trade are, I'm going to say, providers from the portal. Definitely, getting parents to see that they can get on and find providers there, or give them, a list or a link. And then something that I don't know if this is going to sound like, well, no, I guess it's good. Something I've been using lately, and everybody I've shared it with is kind of really happy to see it, is there's another database out there called Psychology Today. And there's a lot of providers. And right now I think one of our biggest calls is therapy and counseling. And so I've been using this website when I can't, find anything else, and I will pull up a list of providers. And what I like about that website, not that the portal doesn't have, but this is something, actually one of our portal employees is a provider on there, or one of our old employer, we know people that are on there. You have to be vetted to be on there. What I like about it is it's a database that you can drill down for certain conditions, certain types of therapy. You can choose, and if you drop down even more there, you can see the big list of issues and conditions that you could you can really drill down to what you want on this. I've had some real luck getting families to find a provider in their area close to home. Just by doing this, drilling down, helping them put their, taking them on if I'm on the phone with them and actually saying, let's get on together and let me tell you how to do this. It really, it's been helpful. And I almost feel like I'm a portal employee, so I shouldn't be putting another database out there, but you guys, this is good. It's been pretty helpful, specifically in that counseling and therapy area. They don't have everybody. They just have, your mental health stuff.
Tina, I don't want you to feel bad at all. The whole point of ISP, Utah Parent Center, Utah Family Voices, Medical Home Portal is to help connect families to the resources they need. And we agree, Psychology Today has kind of figured out the way of sorting and providing so many different items that go into identifying a good mental health resource. It's something we've dipped our toe in the medical home portal, and it's really complex.
It is.
And when you've got something that's complex and there's such a huge need for it, we definitely agree that Psychology Today is a great resource. Yep.
It's just kind of one of my favorites for when we get into, I live rural, and it used to be a lot of Googling and a lot of trying to find, for locating people in an area like that. Now it's kind of at your fingertips with this database.
Yeah, that's pretty cool, isn't it? For sure. For sure. Thank you so much. I appreciate that. And I hope I didn't put you on the spot.
No.
Okay, very good. Very good. Does anyone have any questions for Tina? I think one of the neatest parts of the Utah Parent Center, Utah Family Voices model is, of course, that it's parents who have experienced much, if not all, of this themselves. And so they have a very unique perspective and one that can be extremely helpful for other families. All right, well, does anyone want to pipe in with some of the things that you're doing, maybe in relation to, the poll that we took? We'd love to know a little bit more about what it is you guys are using to keep track of kids in your practice that need follow-up. If you're comfortable sharing, we would love that. You can put it in the chat if that is easier.
So I wanted to just ask directly, we kind of collaborated on the questions we were asking in that poll. And I'm just kind of very curious about how, as care coordination, you determine who are the folks you're going to pick up, because you are a finite resource in your office. And I know a lot of times just the sheer number of kids in a pediatric practice is huge. So you've got a lot of well child stuff going on, but when you have kids that have issues and concerns, how do you determine really which kids you're going to follow? And I'm curious, is it kids who are medically non-compliant? I am the father of a 26-year-old who has type 1 diabetes. And let me tell you, it was pretty rocky there with compliance for a few years. And I'm sure we were on several providers' lists just to kind of keep us in check. So I'm just kind of curious how you guys do it. Do you look at all kids with special healthcare needs, kids who are not very compliant, or are you looking at maybe kids who have certain diagnoses, whatever?
It is kind of interesting. I'm not sure if you guys can see the poll information. I have it on my screen, but I don't know if it's showing through. No, it's not. Okay, I don't know if there's a way for me to do that. But the questions that we asked, or rather the responses that we included for that question on the criteria for following up include children with any special need, whether it's physical, behavioral, mental health, or developmental. And we had 78% of respondents indicated that's criteria they use. Then another response option was children with acute needs, such as tech dependent, major medications, non-compliant with a treatment plan, or et cetera. With 57% of our respondents indicated that's part of their criteria. 13% of respondents indicated that if a child is in state custody, like foster care or juvenile justice system, that's part of their criteria. And then 4% said that they look for only children with special health care needs of a certain age. So for instance, only preteen kids or under 6 or what have you.
Mindy, this is Heidi. This is these are always like such a hard question because I think the issue is that, well, when I was a care manager, my past life, when I was a care manager, the issue is that it waxed and waned, right? I mean, we had some kids that had like Down syndrome, and then they were trached, and they had all of these medical conditions, but the parents were so on top of it that we didn't really need to do much coordination, like, because the parents were so involved. However, then you've got the other hand where the child may just need food and mom has to go back to work. It's just, this with Epic, when we first rolled out, because I was on the whole, when they rolled out the, I can't even think what it's called now. It was a ridiculous number. It was like a percentage, like the Epic would identify children who had, who are seeing like specialists and who are seeing, had certain medical conditions and stuff. And then they were assigned a number. And in that number, they would indicate if they were high risk or not. The issue is that I felt like that number was completely irrelevant because it was picking up the kids, yes, that had a subspecialty appointment from primary children's, but it wasn't picking up the kids that had like ER visits because of asthma exacerbations. Like every month they would be in the ER because of asthma exacerbations. And then when you finally figure that out, you call the parent and they're like, we can't afford our controller medication. And you're just like, gosh. So in one sense, it was picking up numbers. It was picking up people, yes, that was medically complex, but we wanted them to go to subspecialties, right? And so in reality, it was like, I felt like those kids were pretty well under control because they had a subspecialty care manager, they had a primary care manager, and they were being met and they were being seen. However, it was the kids that were kind of falling through those cracks and a lot of them, yes, we figured out in the refugee population, it was a lot of those kids. They didn't understand why they couldn't have hematology as their primary care provider. Like they just, so that when you pull up that question, I put other, because what I would do is I would download from the EHR to an Excel spreadsheet, and then I would work off an Excel spreadsheet. And the complication was that Epic and Icentra didn't integrate well, right? So you had to use 2 EMRs to make sure that the care was being coordinated. It's such a, it was hard because primary children, sometimes some of the information would go into the CHI and then the CHI would download into Epic, but a lot of times that was up to primary children's if they were going to download it or not. Right. And then if they schedule an Epic, but then all the notes were in Icentra. So care coordination for kids is just not black or white. I think
absolutely
that was kind of my whole frustration with this whole PCMH risk score, because I don't feel like it truly identified those that needed the help, right?
Yeah, I think you've really hit on something, and a big part of why we're doing this today is that, there isn't just one fixed approach that if you plug in these, criteria, and you have this intercept coming over here, that bam, you're going to identify everyone, you're going to know exactly what to do, and you can just plug in those automatic reminders and it'll happen. There's a very subjective part of care coordination that requires you guys and your expertise, and it can be overwhelming. And when you have things that are not playing well together, but you're told that that's the future and that we have to be utilizing them, it's hard.
Yeah,
it's really, really hard. Janet from Southwest Children's Clinic wrote in the chat, we have children that are on medications that have to call every month for a refill. They are only given 1 month's worth of medication, and they should have a follow-up every 6 months. They will be notified by the 5-month mark to make an appointment for a follow-up to keep getting refills. We then have them schedule 1 in 6 months and a second follow-up in the next 6 months to be combined on their well child check. Oh, that's nice, Janet. That's a great way. Yeah, a big thumbs up from Eric. You guys have really thought that through, because I mean, one little mishap in the timing of all of that can really cause problems, can it? So that's wonderful. Really, really helpful. Cool. Well, I am noticing that the time is kind of flying by. And so I'm going to actually see if we can put up our second poll. So Michelle, if you don't mind, that would be terrific. All right, so a couple questions here for you guys. It's really interesting to watch these responses come in. All right, well, we encourage you, if you haven't completed the poll and it's something that's applicable to you, to do that. And I'll just talk a little bit while the remaining responses are coming in. The lack of staffing or having a care coordinator, we're seeing 67% of respondents at this point in time. I know that's a really tough thing, and I'm not sure that we have a fix for that through what the Utah Children's Care Coordination Network can provide. But as you heard earlier, we do have some outside resources that we hope you'll avail yourselves of for sure. Creating and maintaining a registry. Yeah, that's a challenge. 27% said that, but there's 73% of folks who've responded who apparently are able to do that in some way, shape, or form. So that's fantastic. Another 67% of respondents say connecting families with support services and specialists. And again, that's where Utah Children's Care Coordination Network, that listserv. These meetings, we hope, can be a help. You are very welcome to email me at the Medical Home Portal, and we will do our very best to respond to you there. The portal, of course, is available 24/7, and we're always trying to keep it updated and make sure that you're aware of how to use it and those features. Let us know if we can help you more with that. And then, Utah Parent Center and ISP, we are here for you. The ability to bill for care coordination, 27% of respondents are having trouble with that. We've done some information on this before, and there is information on the Medical Home Portal about billing that we try to keep updated. It's complicated and it's a bit of a moving target, but there are more opportunities for that now. And we'll put that link in the summary of the meeting notes, but that might be something that we talk about in a future meeting as well. So I'm not sure if anybody's put any others in the chat. The one thing that's really interesting to note about this is that no respondents have indicated that their practice doesn't track for children with special health care needs. And that's lovely to hear. That is wonderful. So just quickly, I'll look at the responses for question 2. 27% of respondents say we have a great registry system. That is fantastic to hear. 60% of respondents say we provide regular follow-ups for our families with special health care needs. That's wonderful. 27% say that your practice does have a policy for tracking special needs. And that's so important, right? That it's coming from the practice level and it's like a policy. That's tremendous. 73% say they're connecting families with supports, services, and specialists. And I'm sure that there's a couple of ways of looking at those two responses on that question. I think that you can be doing it, but also feel like you could be doing it better, right? And then we do have some other. And so, yeah, if you feel confident about entering anything in the chat with regard to your other responses, we'd welcome those as well. And that's really interesting stuff. Eric, do you have anything you'd like to add or ask?
Well, I was just reading what Erica put in the chat where she said a lot of the problem is getting parents to do the kind of the homework and the part that they need to do. We all know that we can lead a horse to water, but can't make them drink, to use a trite adage there. But that is a huge challenge. How do you motivate parents to try to work to help their kids? We do benefit fairs, or historically we've done benefit fairs with the school districts. And it's very interesting that I see the same parents from district to district to district. Parents are hopping around desperate to find solutions to help their kids. But quite often they're looking for something that is a really quick, easy fix. And unfortunately, most of this requires parent involvement to try to do some of this. And we can do a lot of hand holding, but we can't always make parents comply with what needs to happen. And this is particularly true as we work with families of kids who are in transition. I can't tell you how often we've talked to families for a while, they're not moving along, all of a sudden their kid turns 18 and now it's crisis mode. And it's a challenge. It's really difficult. You can't be more motivated than the parent is part of the issue there.
Yeah.
And one thing real quick that you might just think about too, and most of you probably do, but go on to the Parent Center event calendar and look and see if there's anything related to the challenges you're having with these parents, and say, hey, you're not the only parent that has these kind of challenges, and they do have some classes here to help you, learn about this or that. I mean, but there's so many different things we do education on. So, that can be helpful too, to just let them know they need some education. It doesn't hurt. I mean, as a parent that's been doing this for 22 years now, I needed a lot of education to understand how to take care of my kid. So.
Yeah, totally. I agree.
one of the pieces there too is that we're discovering we have a particular family that has 2 transition age twin daughters, but mom has a lot of issues personally that we need to work through to get her to be able to support her daughters. So, you know, I didn't want to sound, you know, kind of cavalier about parents not being compliant. Sometimes parents just do not have the wherewithal to make it happen. They're overwhelmed themselves. They're dealing with their own mental health issues possibly, or sometimes intellectual disability themselves. And so that compassionate side, trying to help and empower them as much as possible is super important. And to be compassionate and empathetic with those families.
Yeah, 100%. All right. Well, this has been great. So much is going to go into the summary of the meeting to send out. But we did want to come back one more time. So, Athena.
Yeah, so I would love to hear from you guys just in the last few minutes here about any things in the portal that have particularly helped you as a care coordinator, or that you like most, or that you find most useful. It could include pages you refer parents to frequently, or pages you refer to yourself for your own education, service provider, or features, anything like that. And you can jump them in the chat, or you can hop on and speak as well. We'd love to hear.
Actually, the other day I was kind of stuck with a family being evicted down in Provo, and I did the search and I found a wealth of information, not only legal kind of things, but also an agency that would help pay for a temporary fix. And so I think this is going to help the mom, but yeah, it was great. It was information that we needed, and it was stuff that we needed fairly quickly.
Thanks, Walt. It looks like Eric's dropped into the chat as well. Love the directory feature and the ability to locate services locally. Our map feature there is newer, and so that's something too, if you are struggling to find things in your area that might help you locate things that might be a little closer to where the patient lives, if they're a patient that travels from another area. There's another comment in the chat about the care notebook is very helpful. That's also recently been updated. I know Mindy was just on that page showing it as well. That's a tool that might help move parents along in their ability and capacity to take on some of this the work themselves, and will help kind of guide them in this process also. We're at 10 o'clock. Mindy, do you want me to stop? Mindy,
You're on mute, Mindy.
You're still muted.
You're still mute.
Goodness. Thank you. Sorry. Okay, now I'm past time, and our next meeting is December 15th, and it's going to be on self-care. We're going to have a lovely presentation. It's going to be for you guys, yourselves, and we hope you'll join us. And of course, Gabby's going to take a few minutes at the top and talk with us a little bit more about the mental health project she's been working on, and that will be wonderful too. So we hope you can join us. It's early enough in the month. I hope that won't be a problem. And then here's that listserv address that we mentioned that we really hope you'll take advantage of. Again, it is also for you to help connect you with this group in between meetings. And thanks so much, guys. Go forth and have a good rest of your day. Happy Thanksgiving to everyone. Thank you.